Hello, everyone, and welcome to the Aging Information Committee's webinar on making decisions on assisted living. Today's speaker is Justine Bykowski, is a retired medical assistant from the University of Michigan after a career in gerontology and adult education. She received Specialist in Aging certificates from the U of M Institute of Gerontology and Higher Education, and higher education certificate from Harvard University. Her work at the U of M and Michigan Medicine began with projects in age-related research involving her with long-term care settings and the larger community. Her career focused on counseling and teaching older adults and their families on decision-making factors regarding their long-term care choices. She received the Anthony V. DeVito II Memorial Award in 2006 for outstanding service, dedication, and commitment to excellence in the field of geriatric education in Michigan. Post-retirement from the U of M, a second career followed with the Michigan Attorney General Consumer Protection Division. This culminated in a statewide educational program to raise awareness about some of the unknown factors that consumers face when choosing senior care residents, as well as how to use data sources to find regulations and violations and make complaints. Very important to be able to do that. In 2021, she collaborated to survey a sample of Michigan's licensed home for the aged, HFA, examining their most serious and frequent violations. A report is available. Building on this work, she currently offers educational programs to the public to discuss HFA's promises and pitfalls. In May of 24, she received the Volunteer of the Year Award from AgeWays, nonprofit senior services, a statewide sponsored organization, for her contributions to support caregivers. And with that, I will turn this over to Justine and make her our presenter.
There you go. Okay. Oh, well, so good to be with you this morning. Thank you for joining me to hear about some of the complexities for older adults and their families when choosing long-term care. Specifically, assisted living is what we're going to be focusing on. First of all, I want to say there's no perfect place, no matter if it's in your home, in a hospital, in a rehab center, in a nursing home. There's no place that is perfect, but every place should have a level of safety and a quality of care that is going to protect us. Now, today, you're taking a very important step. You're educating yourself, and that offers better outcomes. Choosing an assisted living is a complex and emotional decision. We are not focusing on the emotional aspects. We're going to be talking about the system. I'm going to be talking to you about some of the component parts that work together to serve residents in assisted living residences. First of all, let's talk about the promise of assisted living. Well, it offers a lifestyle that's very different than nursing home, which is very institutional. And the nursing home is regulated by the federal government and the state. Assisted living is not regulated by the federal government, it's state by state. Now, that promise is a home-like environment that offers the opportunity to reduce socialization, I should say isolation, and increase socialization. And you're in a place that can support your independence, and you're able to continue to participate in the wider community. If your health is good enough, you can go out and meet people for lunch. Perhaps you can invite them in for lunch. You certainly can choose among the activities that are offered at a particular residence. Also, when people move to an assisted living, we're wanting to age in place, and that may or may not be possible. So this might be your typical senior residence, and senior residences have different configurations. You can enter an independent living, go through assisted living, memory care, nursing home. That's one type, a continuum of care. There are those that are just a combination of independent living, assisted living, some that are standalones like memory care only, which is a type of assisted living for people who have cognitive issues. So they come in different configurations, but we're only focusing on assisted living and memory care. So in Michigan, assisted living is a marketing term, as is memory care. Neither one of them have any regulatory meaning. Also in Michigan, there are three types of assisted living: licensed home for the aged, home for the aged that's exempt, and we'll talk about what that means, and licensed adult foster care. They are not medical facilities like a nursing home. There's no medical director. And, you know, it's big business. There are owners that may be individuals. There may be limited liability companies, REITs, investment trusts, corporations, or nonprofits. Often people ask the question, well, what's better, a nonprofit or a for-profit? There's really no hard research on that. It's really up to you to do your research to find out what's the best fit for you. So here's something that's very important. It's the statement of purpose. The statement of purpose tells you what the philosophy of the home is, what their mission is, and how that reflects to meet residents' needs and services. In an assisted living, you are a resident, not a patient. Again, a difference with nursing homes. So this is very foundational. So how do you know this? Well, you may read it in a brochure, you may see it on a website, and certainly this is something you'd want to probe when you go for a visit. Now, one of the handouts that you are receiving is a level of care chart, and this is just an example, but it's really important to consider when you are a seeker of care, where you are in relation to your needs. So you can see here that there are 3 levels, and every assisted living community will define these levels in a different way. But just to give you an example, an obvious example really, let's say that minimum assist is that you're continent, you're independent in bathing. A standby may be occasional incontinence, and that you need some help with a setup to pursue bathing. And then with hands-on assist, you're actually getting actual help in bathing, and you're getting incontinence management. Now, you see here that there is skilled nursing. Some communities may offer some practices of skilled nursing. For example, you may get a 2-person assist. These are all things that you really have to probe in terms of understanding how levels of care are defined in each community. There's no standardized assessment of levels of care, so each community has their own. So that's very important to keep in mind, and this is just to provide you an idea of how you can begin that conversation. So let's look at licensed homes for the aged. Well, they provide room and board, supervised personal care for more than 21 persons who are 55 plus. There may be exceptions for under 55, but that's a possibility. So they have admission contracts, and we'll talk more about that, in a service plan. That is their assessment plan, how they determine what your level of care needs are. They need to have appropriate levels of staff always awake and a supervisor on all shifts. Now that is a regulation, but let's think about what that means. it's very vague. So each home for the aged would define what the appropriate level of staffing should be, and that should be determined on the needs of their residents. But again, this is something that you need to probe. What are their staffing levels, and how would that meet your loved one's needs or your own needs? Now, they need to implement and maintain and evaluate a quality review program, and this is an internal review. So if there is an incident, let's say there is a medication error, they are to look at their deficiencies and come up with a plan so that those deficiencies are eliminated, and then they review that in another year. Here's an opportunity for you, because if you go to a licensed home for the aged, you can say to them, what have you found out in terms of your quality review? What problems have you come up against? You know, you may not feel comfortable in asking those kinds of questions, but they really are important questions. A good thing about a home for the aged is that they have annual inspections by the Department of Licensing and Regulatory Affairs. That's the state's licensing authority, LARA. So that is a positive that they are inspected each year. Now let's look at homes for the aged and their admission contract. You can see here that they have to tell you what their fees are. These are some disclosures that they have to make to you. The home's policies as it relates to the retention of residents, that's very important, and we're going to come back and talk about that. Their service plan needs to identify residents' specific needs for care, maintenances, activities appropriate to their social, behavioral needs, and their well-being. And that is supposed to be very specific to the person. So let's say somebody has a tremor. That would have to be related to that issue that the person has to deal with. Or perhaps the person has severe hearing loss. Well, that has to be a part of the plan in terms of how to communicate appropriately with that person. So they also have to have methods of providing the care and services while taking into account the preferences and the ability of the resident. So let's say that the resident needs oral care. So do they use a soft toothbrush or do they use an electric toothbrush? What are their preferences? What are their needs? So very concrete and specific to the person. And you have to be a part of that. If you're the care seeker, that's very important. So let's look at exempt homes for the aged. This isn't very well known that there are such things as an exempt home for the aged. They provide the same level of care as a licensed HFA, but they are not required to follow licensed HFA rules or provisions of the law. They are not required to have residence rights. And one of the things you can download are the resident rights for people who are in HFAs, or they don't have required disclosures. And Laura only investigates them when there is a complaint. They don't have that internal process that I talked about with the licensed HFAs. And the complaint has to allege a death, a serious mental anguish, or a serious physical injury. So, here's something that is really not known. I live in Washtenaw County, and I'm pretty well acquainted with the different communities in Washtenaw County. And there's a continuum of care community. Their memory care is a licensed adult foster care, and we're going to talk about what that is very soon now. And their assisted living is an exempt home for the aged. How would you know that if you went to visit, that you would have to ask what the licensing is for each one? And we have other examples in Washtenaw County with that same combination. So let's talk about adult foster care. Adult foster care is for those who are 18 plus, and they can be small, 1 to 12, or large, 13 to 20. And the residents may be aged, mentally developmentally, or physically disabled. And here's something to keep in mind. Large home staffing, this is by regulation. Daytime has to be 1 to 15, and for sleeping hours, 1 to 20, and they're not mandated to be awake during sleeping hours. So think about that in terms of the needs that your loved one may have, and the safety that can be provided if they have this level of staffing. They may have more, but they're not to have less. What would it mean if somebody needs to get up in the middle of the night and they need assistance and they have to wait? If there are more than one person in the middle of the night that needs assistance. So, you know, these things really have to be thought about in terms of the care needs of someone and in terms of how their care needs will build over time. Laura inspects them every other year. Now, there is some legislation pending. It's called Teresa's Law, and the purpose of it is to improve some of the components of adult foster care, namely transparency and training. And when we begin to talk about the training, you'll see why Teresa's Law is needed and why it would be important for you to become acquainted with this bill. There is a substitute bill now so that you can support improvement in adult foster care. So in adult foster care, there's a care agreement, and it documents the resident's needs. And as a part of it, it lays out each person's responsibilities, what the admission criteria are, the home's discharge policy, and their procedures, and personal care and supervision and protection. So you actually sign off on this when you fill out this form with the licensee or the administrator of the home. So it's very important that you understand what the personal care needs are. Now, if you're living with a person, you probably have a pretty good idea. But what if you're planning for an aunt who is in another state? How well versed are you in understanding that person's needs? And how can you become better informed of their needs? You know, that is something that you have to figure out. Now, the care agreement is based on the assessment plan. In a home for the aged, it's a service plan. In an AFC, it's an assessment plan. And it's done with the resident ideally, or with the resident's designated authority. Now, it should be based on the MD's appraisal and instructions. And it also includes all the policies and rules and the house rules and other terms. So what are the house rules? That's something that the AFC has in terms of when you leave, what you might have to do. Can you invite people in? Can you eat in your room? What are the rules around that? Not everybody wants to eat with everyone all of the time for different reasons. You may not be feeling well. You may be somebody who needs more privacy. So what are the house rules or policies, and how do they impact your independence and the control? Because that's part of the promise, right, of assisted living. So let's look at some of the common homes for the aged and adult foster care regulations and practices. So I already told you that it provides room, board, supervised personal care protection. and a plan of care, including medication administration. Now, the medication administration is really very challenging. We're going to learn why that is a particularly challenging component of assisted living. So here's the admission package, the care plan, the contract, the health appraisal, if under an MD's care. You have to share with your MD what the assisted living environment is like. Not every doctor has been in an assisted living. Not every doctor knows really what they do and don't do. So really, this is something that you have to share with your doctor. And particularly when it comes to medication management, I'm going to make a big point about that. So the staff must have background in criminal record checks, which is really a good thing. And they should be screened for TB and having an annual review of health status. So those are really two positives. So residents cannot need 24-hour care like in a nursing home. It doesn't mean that you can't bring in somebody. In fact, I had some friends who were in assisted living, and they had supplemental caregivers who came in about 14 hours a day. That's pretty expensive. They were able to afford that because they didn't feel like they were getting the attention that they needed. Certainly you can have somebody come in fewer hours. That's something you have to coordinate with the assisted living. There may be nurses. It's not unusual in a home for the aged to have nurse managers. Less usual in an adult foster care, although in an adult foster care, the owner may be a nurse, but their services are limited. They can't diagnose, they can't treat. But, they can clarify doctors' orders. They can, they're trained to look at side effects. So it's a real positive to have a nurse involved, even though what they can do is limited. They do offer hospice and outside RN or therapist services. So again, this is something you have to coordinate with the home, bringing in any outside services. Now let's talk about residents, how they can be involuntarily discharged. If your care needs go beyond the level of care that can be safely provided by an assisted living, this is a reason for discharge. This is one of the most fundamental regulations. They are not to accept people that they cannot care for. Sometimes they really do overstep. So this is something you have to watch too. But to be involuntarily discharged, a place with integrity will be helping you planning along, keeping an eye on your loved one and saying, I think they're going to reach a point where we can no longer take care of them and you should start looking. There are a lot of rules around this. You need 30 days notice unless there's something that is really serious. The person is a risk to themselves or others. They no longer fit in. And if you don't pay your bills. But this is something that is disclosed, not in an exempt home for the aged, but with the licensed HFAs and AFCs, this is disclosed, and you want to be sure you understand that. So let's talk about the training. For administrators and licensees. So a licensee for an adult foster care is the person who takes care of the day-to-day. The administrator may be also, and not necessarily the owner. There is no certification required. Interestingly enough, for an adult foster care, there is required continuing education for administrators and licensees. So that's a good thing. Not for homes for the aged. There is not that requirement. And so that's something you should ask them about, what their training is. That's something you want to know anyway, no matter where you would start to look. How do they train their staff? So let's look at the training of direct care workers. It's very basic. There's the onboard training, which is required by the state. And you can see here what it includes. And one of the things it includes is residents' rights. And the home for the aged residents' rights, they are more than for adult foster care. So you can compare the two. They are part of the handouts and reporting requirements. And reporting is very important because they are to report on your medication administration. But then there is the on-the-job training. And that may or may not occur. It depends on the provider and how there's no regulation about that. There's no required continuing education for direct care workers. This is something Teresa's Law is trying to change, that the foundational training is better and that there is required continuing education for direct care workers. So that they can be more confident in doing their job. And also it's a way of helping to retain staff if you invest in them. We've all been in workplaces and we feel if there's an investment in us as the worker, we have more loyalty and we really can do a better job. Same dynamics go on here. Now, very interestingly, if a home for the aged or an adult foster care advertises that they offer dementia care, they are required to have these disclosures unless they're exempt. These are required disclosures. Now, most of these are already typical disclosures, services provided. You may have to probe about frequency of activities, additional fees, discharge criteria. But here, they have to disclose what the staff training and continuing education policies and practices are. So this is for a select group of people, and Teresa's Law is saying, let's do that for everyone who's in an adult foster care. That should be fundamental disclosure that should take place. Importantly, too, is the physical environment and the design features that are appropriate to supporting someone's functioning. I'm sure that you've heard about universal design. This is something that makes it easy for all of us to navigate our environment, but certainly in a home that supports older adults, you would want safety features in the bathroom, like grab bars, a low step to get into a shower versus a bathtub, rails along the hallway, those sorts of things. And there may be other support features that are important to your loved ones. So you'd want to look for those. So how do you find them? Well, you can call the Area Agency on Aging and they will provide you a list. You can call the Alzheimer's Association. All of this information is in the handout that you're going to get, a guide to Michigan's assisted living, search tools, your rights, state regulations, violations, action steps, and tips, all in there. You don't have to try and jot this down. Then there are the for-profit placement agencies. You may decide to use them, but if you use them, you have to understand that they have business agreements with certain residences, and they get a fee when a placement takes place. They may be able to give you some good information, but if they're not telling you how to find violations and to look up the renewals of license reports, then I would say that they're not giving you the full story, and they're omitting important information for your decision making. You can also go to the Department of Licensing and Regulatory Affairs website, and we'll be doing that. So many different ways of receiving this information about where you can find locations. So let's look at some of the assessment guides that are available to you. I'm just giving you a couple of examples. There are many out there. The Healthcare Association of Michigan offers one. This is an industry group. Actually, this assessment guide is really good. It goes over a number of features of the home, as well as looks at some of the training, services, practices, and it's worthwhile to download. You can also call the Alzheimer's Association for their assessment guide. AARP has one, and this is in the handout that you can download following the program. Often people are very curious about the cost. That's a good thing to be curious about, because costs can vary by location. Here, Genworth Financial Long-Term Care, they're an insurance company. Perhaps some of you have long-term care policies with them. They do estimates. I just recently did one for Washtenaw County. And what I found out for assisted living was that the median cost was $84,000 a year. Another association that focuses on older adults on long-term care has the national average at $64,200 a year. But where you live will make a difference. Perhaps prices are different in the UP than they are here in Southeast Michigan. So this gives you a cost estimate for all of these services here, which is a good thing. So it was mentioned that Barbara Zarrett, my colleague who's helped to develop the work that we've been doing, educating and reaching people across Michigan, and writing a report on the work that we did looking across the state of Michigan at the violations of HFAs. We looked at those that were small and large, with and without memory care, and that were urban, rural, and suburban. We wanted to get a cross section. We did this work in 2020, and we wanted to focus on the violation of regulations that caused the greatest harm and injury and happened repeatedly. Now, these stay on Laura's website for up to 3 years, but that 3-year clock starts ticking at the time the report is completed. And Laura does not have a time when it must be posted. So actually something could be on there for only 2.5 years or 2 years, depending upon when Laura will post the violation. There's no public information on remedies. In other words, how violations were corrected. That's something you have to request through a FOIA, Freedom of Information Act request, and you do find that on Laura's website. So let's look here all right, whoops. I'm gonna go now to the state search for adult foster care and homes for the aged. And what I wanna show you is how to search for violations and the renewal reports. So, okay, let me see here. I want to just find the exact thing that I want you to do. I just need a moment to do that. So I want you to go to the drop-down box that says any licensed facility. Okay? Are you there? Dale? Hello?
Yes, I'm
Dale?
here. I'm sorry, I was.
Okay. All right. So when you go to that drop-down box, I want you, everybody can see that it lists the different adult foster care, but I want you to click on Homes for the Aged. Underneath the Homes for the Aged, there are the exempt ones, but we're not going to look at those now. But just click on Homes for the Aged, okay?
You want me to search? Should I
I
search?
just I just want you to click on Homes for the Aged right now.
Did
So,
that.
okay, then go to County.
Okay.
And then put in Washtenaw. There's a drop down box and
Yep.
go to
Done.
Washtenaw and then click search.
Okay.
All right, so what will pop up are the homes for the aged, the licensed homes for the aged in Washtenaw County. I want you to go to University Living, and that will be the next page.
Uh-huh.
Okay.
Done.
All right, so at the top, you will see a special investigation report, and I want you to click on view.
Wait a minute. Oh, okay. Gotcha.
Okay, all
Yep.
right, so
I'm
that
sorry.
pops up,
Yep.
and
Oops.
so what you're seeing there is the page that gives you information on University Living, all the details about it. But I want you to scroll down until you see reports available. Oh, you did that because view popped up, right? And you
Right.
have okay. So, and you clicked on the special investigation report. With this
Yes.
report, you see that there are two violations. One is that the resident was over medicated on Seroquel. And then there is another one, the Seroquel one is an established violation. The second one is not established. So you will find that some of them are established and others are not. But if you run down that report, you will go to an analysis, and it will tell you about why they were in violation. And these reports are very detailed. The narrative, it tells you who they interviewed, when they interviewed somebody, and you can follow the whole investigation. So when Laura comes out to investigate and they find a violation, these very comprehensive reports are done. And within 15 days, the University Living, in this case, has to have a correction plan. Laura will give technical assistance. And if for some reason University Living doesn't come up with a correction plan, Laura can pause admissions or they can take other actions. Those things are highly unlikely. They want to invest in having the home come up to regulation. So that will be the goal. Now, you can, I don't know if you got a chance when you looked at this to see how many special investigation reports University Living has. That is not a positive sign to me personally. It would give me a little pause. It's important also to look at the renewal of licensing. Now, we're not going to do that, but if you did that, you might find that the home didn't do their TB screening. You can pull out of that and go back. We'll go back to the slides. Or
I'll,
a home,
I'll make you presenter again.
okay,
Rock.
okay. So if you looked at a renewal report, it's important to look at both reports, the special investigation report and the renewal of the license. And again, for a home for the aged, it's done annually. You might find that they didn't do their TB screening, that they didn't complete assessment plans, that they have assisted devices, but that they don't have the manual to fix it if something should go wrong. So this may suggest to you that, well, they have a lot of ways in which they need to come up to the regulation standards. This is something that you can choose to discuss when you visit a home. They're going to be pretty surprised that you're so sophisticated that you would know how to look for violations and you would know how to look at their renewal reports and discuss with them what steps they have taken to mitigate or eliminate deficiencies. Okay, let's move on here. So when Barbara Zarrett and I were doing our work, when we were looking at the HFAs across Michigan, these were the categories of red flags that we came up with when we were looking at the different violations in terms of the problem areas. And you see the two top here, service plan and medication administration. Those are, I'm going to give you examples of. Medication administration is a major problem, no matter what state you are looking at. But Michigan does present some special challenges because of the lack of staff training. So here is an example of a service plan regulation. So what's expected is a specific care plan, and at admission and annually, and when there's significant change, that it be updated. Now, this is where you can step in. Now, the home is only required by regulation to update it annually, but you may see changes along the way, and it's important for you to make sure that those changes are updated. So this is part of the role of the advocate. So the service plan needs to be planned with the resident or the resident's authorized representative and with the home administrator. So all of these people can get together and have the best plan in place for the resident. So this was the violation. It had ambiguous terms such as redirection, therapeutic communication, and staff intervention. So if you were a direct care worker and you came on shift and you were reading this resident's service plan and you saw the resident, let's say, was getting agitated, and you read that you had to redirect them or you had to therapeutically communicate with them. Well, what does that mean? That really doesn't mean anything. It has to be more specific and concrete. For example, give the resident a snack. Take the resident for a walk. Give the resident something that they can, that will distract them. Perhaps ask the resident to tell them about their family pictures. So, you want to calm the resident down. That's the point. And for each resident, there are going to be different approaches to use. So here, it says here that the resident they did not indicate the methods to address the non-compliance. So some residents can be very difficult. I mean, they may not go along with the bathing routine or taking their medication, and it's important to indicate a method how you can bring that person along. So when a home, this is the regulation, when a home supervises a resident's prescription, they have to, I can't see part of the screen, so excuse me. When a home supervises the resident's prescription medication, then the rules require written instructions from the prescribing licensed healthcare provider who has knowledge of the resident's medical needs. And there have to be written instructions for adjustments. Now, you were told about the training of direct care workers, and this is something that should be shared with the doctor so that when they are writing instructions, that they realize that they are writing instructions to people who don't have a medical background, and that these people may not be able to identify side effects. So that I would encourage the doctor to put that in, or to provide as much information as possible to give guidance. Now, on your handout, it gives a lot of tips about how you can improve the medication management. So here's another example of a violation. The resident refuses medication. The review of the medication administration record revealed refusals were not documented on the MAR. That's required by regulation. Resident's physician wasn't notified, again, a violation. The medication incident report was not completed, and the physician's instructions were not on the resident's flow sheet. All of these were violations. So here, what you want is for the physician to be notified, and the physician can make the call as to what the next steps are. And the incident should be discussed on the report, so that everyone knows that this has occurred. And you want a complete medication administration record. And as a part of Teresa's law, this is something that is an objective, is to have this as a part of the resident's rights, so that the resident or their designated authority can review the medication administration record. It's another way to have some kind of quality control if there are other eyes on it. So let's talk about how you can find out what the regulations are. Again, this is in your handout. You can go to this website and look up what the regulations are of a AFC or an HFA. You may want to dig into that, you may not, but if you do, they are right here. So what happens when you need to troubleshoot? Well, as I said, you can choose to review the regulations, and you should know what the resident's rights are. First of all, you want to discuss an improvement plan with the care supervisor, the administrator, and if it's a small matter, it's something that you can take care of right away. I had a 96-year-old friend in a home for the aged who was legally blind, and I'm going to give you some examples of some of the issues she brought, that she encountered, because there are bumps in the road that she had to iron out. So within a month of being there, she was pretty unhappy because she was seated at a table where she couldn't communicate with others because cognitively they weren't at her same level. So that was pretty disappointing to her, because she was a very social person and she's really looked forward to meals so that she could engage with others. Well, her grandson, who was her designated authority, brought that to the attention, and that particular HFA had a LPN, and within a next couple of weeks, she was moved to a table where she could have some good companionship. Another time when I was there, she had just returned from the hospital. She had had a fall at the home, and they do train their staff on picking up people from a fall. Not all of them do. That's something that you have to ask. Some of them call in the fire department, but at the home she was at, the staff could help her get up. And she did have to go to the hospital. And when she came back, she had a smartwatch that had a sensor on it where she could call staff. And she had pressed the button, but nobody had come. So a half an hour passed, and I went to the desk and I mentioned that her smartwatch wasn't working. Well, within 45 minutes, they had that fixed. I was able to stay with her during that period of time. And they also sent a staff person during that period of time to double check on to see if she was okay. Another time when I was there, there was a COVID lockdown. People weren't able to go to the dining hall. They had to eat in their rooms. Her meal was skipped. I came at 2 o'clock in the afternoon. We did get a meal for her. And so, these are regrettable, but they did respond right away and take care of it. The kind of incident that you want to be aware of is when they're not correcting it. Even though you're monitoring it and you're encouraging them to adjust their practices so that it's preventing let's say, a fall or a medication error. And you're saying to yourself, things just aren't working. So after you've monitored and you've tried to adjust it at a local level, you may want to take it another step. And what I would highly recommend is that when an incident is beginning, that you begin to document all forms of communication, text messages, emails, discussions. Just keep a good record. So this is what you can do if you feel that you can't solve the problem with the home itself. You can make a complaint to Laura. You can call them. You can go online to file a complaint, and you can remain anonymous. But if you do that, they're not going to get your side of the story. You can contact the Michigan Long-Term Care Ombudsman. This is a state-sponsored service. It's your tax dollars at work. This is a person who advocates for you. And you can decide how you want to work with them, if you just want to put heads together and try to problem solve, or if you want them to come in and intervene. That's something you can work out with them. There's adult protective services, and that means that something is really, there's harm involved. There may be abuse, neglect, financial exploitation, and you can also call the Michigan's Attorney General's Elder Abuse Line if you are experiencing any kind of fraud or financial exploitation. So let's summarize this. The good thing is that you're planning ahead, best case scenario. Planning in a crisis is disadvantages. Planning ahead means that perhaps you have visited some of these locations. If you've looked into their programs, one of the programs you want to see if they have is a resident council. Are they giving voice to residents or families? Do they have programs that fit the needs of your loved one? What are some of their practices and policies? Can the loved one eat in their room? On what terms and conditions does that happen? Can they invite people in? Their philosophy, is it person-centered, or are practices around the convenience of the staff? How liberal is the time when people can eat? What choices are there on the menu? And their past. And, you know, this is when we were looking at the violations and the renewal reports. This gives you a record, their report card, and you can decide how you want to use this. And it may not be the determining factor for you. Often there are more than one family member involved in making a decision like this. That's part of the dynamics. One thing I would suggest, there has to be the family advocate, the what I call the anchor, but you also might want to have a care circle. That is, people that you can draw in that are going to visit and support you, the anchor, in reaching out and having time with the resident. And that time may be in the residence or it may be outside of the residence. But having a care circle, I think, takes a little less, makes it a little, hopefully it reduces some of the burden and you don't have to feel like you have it all on your shoulders. So I hope that this gives you some information and guidance on how you can make the best choice and the homework that you have to do in order to make the best choice. So I'm wrapping it up here. Questions?
So for everyone that's on the webinar, question here, can we get a copy of the presentation emailed to you? I think it's a fairly large PDF, but I can double check. It will be posted very shortly on the NCRO website, so it'll be available there. And the next item here is, where can you find the handouts? They will be posted on the website, but if you go to the little control panel, there is a bar that says handouts, and they're all there. They're available to be downloaded. There's 4 of them. But again, all is small enough that could be emailed, so maybe I'll just take the easy way out and email them to everyone that registered. Any other questions? That was an excellent presentation, tons of information, and it's a lot to absorb.
It is a lot to absorb. It really is, and that's why planning ahead is an advantage, because you know, you really have to think through very carefully what the needs of your loved one are and how it fits the place, the residence that you are thinking of. And hopefully on that search, you know, you're getting it down to maybe 2 or 3, and you're zeroing in on what you think is going to work the best over the long term. Dale, can I comment on something here?
Yeah, can I do one?
Sure. So sometimes people ask, well, my mom's in a resident. Well, I would suggest, even if you have a family member in a resident, that you do look at the violations and the renewals reports, because it tells you what's going on. It may or may not be relevant to the concerns you have about your mom, but it may be. I mean, if the meals aren't hot or if they are terribly late, you know, that's a general thing that impacts the whole population. And if you have a family member who isn't getting the diet that they need, perhaps the chef, for one reason or the other, doesn't have the, let's say, gluten-free choices on the menu, and they guaranteed you that you're going to get gluten-free choices. So those are some of the things you want to keep in mind. I would always keep an eye on what's going on. Oh, where can you get this information like this in Florida? Every state is different. Florida has, if I remember looking at their website, um, they really do a better job in than. Okay, what stands out for Florida for me is that they have fines for violations. Michigan does not. Um, and they do have a pretty good website. I would go to the ombudsman's office in Florida and ask them how you could look those up. Um, and you could certainly can go to the Area Agency on Aging and ask for a list. They may not be able to give you decision-making tools. Our Area on Agency has them, but they don't make them that um, obvious. You have to really ask for them. So I don't know how Florida deals with that, but you certainly know what to ask for, how you can find out about violations, how you can find out about their regulations. Do they have resident rights? So you can ask for many of those same things.
Same question, just different.
Yeah, it's the same question. The components that we talked about here, the staff training, the disclosures, the resident rights, how you can find out about violations, how their renewal reports, so some of the same features. And again, you can go to the ombudsman, the Area Agency on Aging, to see if you can dig for that. Oh, please explain what OTC stands for. On the job. Oh, that should be on the job training. It's not OTC. I'm sorry. That you
OTC
found
is over the counter.
over the counter. Oh,
Yeah.
over the counter medications. Oh,
Right.
okay.
It's
That's
generally
right.
what OTC.
I got, yeah. So,
OJT is on job training.
right. Yeah, you're right. Okay. So the over the counter here in Michigan, the direct care workers both administer prescription and over the counter medications. So without training, they're handling medications for people who have heart problems, kidney issues, diabetes, some very complex issues with health. One thing I want to point out with the medication administration is that if your family member has several prescribers, who is looking at all of the medications they are receiving so that there aren't going to be drug interactions? You are in a non-medical care facility. So you have to talk about that with your doctor about how that is going to take place. So you have to be alert about all the different prescriptions that are coming in to your loved one and how those are going to get checked for for drug interactions as well as side effects. You want to stay on top of that.
Sorry, I did something and there we go. Oh, here we go. I can answer this question for you. No, our website is open to anyone. There's no password required. So if someone passed along the invite to a relative or friend, you're welcome to go to ncro.org and you can get your answers. Okay, I'm going to back up once. Apparently in your presentation, you mentioned OTC can occur. So that's what I was just.
I have to look, you know what slide that was? Because that may be something that was, there's the on-the-job training, over-the-counter.
I don't know what slide,
Um,
but I can, if I go look for it, I'm going to screw up my.
Okay, yeah, don't look for it. I think there
We'll,
were two ways I used a an abbreviation. On the job training would be one of them. That would be OJT,
OJT.
and over the counter medications. So that OTC is probably a mistake. It's over the yeah, I don't know what OTC refers to. So I think those are the only two times I used abbreviations like that. Thank you for catching that. I apologize.
It's one of my rules from working. Never use an abbreviation without defining it.
Very good rule. Okay, so you already looked it up in Florida. That's great.
Yeah, and then we've got one more here.
The question is Fox Run a good place to age in place? Well, I mean, that's really more for you to answer than it is for me to answer, because you know, we didn't talk about cost, and there's no standardized uh, cost for assisted living. Every place sets its own fees. And, you know, one of the things you have to keep in mind is that when you're planning initially, you want to have a budget and then you want to do projections for the future. And you know, as care needs increase, costs are going to increase, and then there's inflation. Um, so you want to make sure you have a good financial plan and perhaps work with a financial planner. And in terms of the fit with the person, well, it's what the support services are at Fox Run, the kind of training they do, the kind of options that they make available to people. I know that they do have independent living and assisted living there. I don't know. I don't remember if they have nursing home. For some people, you know, having a continuum of care is very important. If you do need to if you do need to leave an assisted living and look for a um, nursing home beds are very tough to get, and you can be put on a waiting list. So that's why even in an assisted living, you don't want to plan in a crisis. You want to keep an eye on how that person is progressing and if they are a good fit with the level of care that can be safely provided. And you know, the the way that they discharge, the involuntarily discharge, is a double-edged sword, because you want people out who can't get the care they need. They're not supposed to be there if they can't get the care they need, but sometimes that can be a stretch. Um, Today, the average age of a person going into an assisted living is 85 years old, and they go in with multiple chronic conditions, and that's not unusual for them to be taking many drugs. So their care needs can be complex. So the question you have to ask is if that assisted living can continue to provide their care needs. And going to a nursing home can be a tough decision for a family. So there's no one answer to your good question. Yes, do please learn more about Teresa's Law. You have it on your screen there.
Yeah, that was just a comment from someone.
Good.
And you used OTJ. Additional OTJ can occur on slide 4 or 13.
Oh, it should have been OJT on the job training.
It's
Yeah.
okay.
That was changed. Yep. That was just switched around. Okay.
It's
my dyslexia.
It's the dyslexic fingers, and I have them.
Yeah,
Okay.
right.
I think at this point in time, I'd like to bring this to a close.
Okay.
Excellent questions, excellent presentation. We're starting to lose some folks
Yeah, I
as
see
far
that.
as attendees. So,
Mhm.
and I understand, but Justine, thank you so much for taking time out of your busy day and spending it with us for the past hour and change to do this presentation for us.
Well, I'm very glad, and I wish everybody the best.
Fair enough. Everyone have a safe day, and I guess at this point in time, we got go Michigan, go State, or go Blue
Uh-huh.
State for basketball. But anyway, take care. And
Okay.
with that, we'll be closing the webinar. Thanks, everyone.